Hi, welcome back to our channel. In this video, we are going to talk about one of the most important organs in our body, the kidneys. We are going to discuss kidney failure or end-stage renal disease, ESRD, a condition that affects millions of people worldwide but is frequently overlooked. What is kidney failure? It is defined as a condition in which one or both of your kidneys no longer work on their own. Understanding it is essential for both prevention and management of this silent but debilitating illness that has the power to drastically change lives. For a little while, picture your body as an efficient factory. It processes countless materials daily, removing trash and making sure everything functions well. Imagine what would happen if that factory began to malfunction. Resources start to run low, waste products start to build up, and the system as a whole collapses. There's a common misconception that kidney problems only affect older people or those with a family history of kidney disease. But the truth is, kidney issues can affect anyone at any age. In fact, according to the National Kidney Foundation, 1 in 3 Americans is at risk for kidney disease. Currently, this illness affects about 88,000 people in the United States, and many more are in danger. The importance of the kidneys for our general health cannot be overstated. They filter waste, control fluid balance, and preserve electrolyte levels. There may be serious consequences if they don't work. Detecting kidney problems early can make a world of difference. Diabetes, high blood pressure, and obesity are some of the variables contributing to the increasing prevalence of end-stage renal disease, ESRD, which is a serious public health issue. Since prompt therapy can delay the disease's progression and improve patient outcomes, early detection and management are essential for controlling kidney health. In order to understand kidney failure before it develops into end-stage renal disease, it is essential to comprehend the early warning signs and symptoms of the condition. The symptoms might not show up until serious harm has been done because the kidneys can often compensate for damage for a long period. Knowing what to look for and being aware of the warning signs help you take proactive steps to protect your kidney health and enhance your quality of life. Being aware of these symptoms will enable you to identify them early and contact your doctor. Number 1. Changes in urination. Pay close attention to your urination patterns. Noticing changes in your urination, such as a decrease or an increase in frequency, can serve as an important warning sign that further investigation is needed. Kidney dysfunction can lead to alterations in urine output. You may experience decreased urine production if the kidneys are not filtering adequately. Conversely, increased frequency, especially at night, nocturia, may occur if the kidneys are unable to concentrate urine properly. Dark-colored urine may indicate dehydration or the presence of blood, which should never be ignored. Number 2. Fatigue and weakness. If you find yourself unusually tired, it could be a sign that your kidneys are struggling. Fatigue can affect your daily activities and overall quality of life. The accumulation of waste and toxins in the blood can cause fatigue, a frequent sign of kidney failure that can make one feel lethargic. Moreover, anemia, which is frequently brought on by the kidneys producing less erythropoietin, can also make you feel exhausted. Remember, blood brings oxygen and important nutrients to your entire system. If circulating blood is deficient, less energy and fatigue can be noticed. Number 3. Shortness of breath. Persistent shortness of breath, especially when exerting yourself, and the breath when performing tasks that you used to find easy should not be ignored. When the kidneys are unable to regulate fluid levels, pulmonary edema or fluid accumulation in the lungs may result. Breathing difficulties may result from this restriction of airflow. It becomes difficult to breathe correctly and produces a feeling of shortness of breath when fluid accumulates in the lungs and fills the air sacs, alveoli, preventing them from efficiently exchanging carbon dioxide and oxygen. Shortness of breath, coughing, sometimes with pink, frothy sputum, chest tightness, feeling of drowning. Number 4. Swelling in the extremities. Edema or fluid accumulation in certain body parts like your legs, ankle, or abdomen may be a sign that your body is having trouble keeping its fluid balance, which, if ignored, may result in more serious issues. The kidneys are responsible for filtering excess fluids and waste from the blood. Because the kidneys are unable to eliminate too much water and salt, renal failure can lead to fluid retention. An excessive amount of protein may enter the urine when the kidneys' filters malfunction. This may result in lower blood protein levels, which may result in edema. Number 5. Nausea and vomiting. Gastrointestinal problems may result from a buildup of toxins in the blood due to the kidney's incapacity to filter waste products. This is often called uremia. The term uremia literally means urine in the blood. These toxins are toxic to various organs like the nervous system. Symptoms of nausea and vomiting, muscle cramps, and skin itching are noticeable. Ongoing nausea can lead to a loss of appetite and malnutrition, further complicating kidney health and overall well-being. Number 6. Persistent itching. The accumulation of waste products in the blood can cause uremic pruritus or itching. This can lead to the shrinking of sweat glands, which can affect the skin and lead to dry skin. New theories revealed that not only uremia is the sole cause, but the immune response plays a role too. Extreme heat or cold, stress, exercise, and taking a shower are all known to exacerbate pruritus. In that situation, it typically affects both sides of the body because it affects the entire body. However, it can also solely affect one area of the body, typically the arm with vascular access, the back, or the face. Severe itching can significantly impact daily life, leading to sleep disturbances and decreased quality of life. Topical therapies such as emollients, creams and lotions that moisturize and soothe the skin, and/or analgesics, creams and lotions that relieve pain and itching, should be applied topically to all patients initially. Number 7. Metallic taste in the mouth. Experiencing changes in your taste is rather usual. It is all because of the waste and toxins building up in the blood and saliva, leading to a metallic or off taste. Food may taste different as a result and cause bad breath. Changes in taste can lead to decreased appetite and unintentional weight loss, which can further weaken an individual. Number 8. Cognitive changes. Toxin buildup in the bloodstream can alter brain activity and result in cognitive abnormalities like memory problems, disorientation, or trouble focusing. This condition is sometimes called uremic encephalopathy. Both personal and professional lives may be impacted by cognitive changes that impair everyday functioning and decision-making skills. What tests do doctors use to diagnose and monitor kidney disease? To detect kidney illness, medical professionals order number 1. A blood test, which is eGFR, or estimated glomerular filtration rate. This test gauges the health of your kidneys. A blood test, along with your age, sex, and body type, determines your estimated GFR. A GFR of 60 or more is in the normal range. A GFR of less than 60 may mean you have kidney disease. A GFR of 15 or less is called kidney failure. It is better to talk to your healthcare provider about the result of this test. Number 2. Serum creatinine test. Your blood contains creatinine, a waste product from your muscles. Creatinine is removed from your blood through urine by healthy kidneys. A blood test that assesses the amount of creatinine in your blood determines your serum creatinine level. It indicates the health of your kidneys. When your kidneys are not working well, your serum creatinine level goes up. Number 3. Kidney biopsy. Your doctor can determine the cause, severity, and best course of therapy for your kidney condition with the use of a kidney biopsy. It is a procedure that involves removing a small sample of kidney tissue to examine under a microscope and identify the kidney disease's source, severity, and potential course of treatment. It can also be used to assess a kidney transplant or to look for cancer or other aberrant cells. You'll be numb during the procedure and shouldn't feel pain or discomfort. After a percutaneous biopsy, you may feel sore for a few days. A pathologist receives the sample and writes a report on the results. Although you may occasionally receive a partial or complete report in less than a day, it usually takes 3 to 5 days to receive the complete results. Management and treatments. Treatment for kidney disease depends on the stage of the disease and can include lifestyle changes, medications, dialysis, or a kidney transplant. Number 1. Medications. The management of kidney disease often involves a variety of medications aimed at controlling symptoms, slowing disease progression, and addressing complications. The specific medications prescribed can vary based on the type of kidney disease, its stage, and the patient's overall health. Here are some common categories of medications used in kidney disease management. Antihypertensives to combat high blood pressure are common in kidney disease. Diabetes medications. For patients with diabetic kidney disease, controlling blood sugar is crucial. Phosphate binders. In advanced kidney disease, phosphorus levels can rise, necessitating the use of phosphate binders. Erythropoiesis-stimulating agents, ESAs. To treat anemia associated with chronic kidney disease, medications such as epoetin alpha or darbepoetin alpha may be used. Bicarbonate supplements. In cases of metabolic acidosis, sodium bicarbonate may be used to help balance pH levels. Number 2. Dialysis. Dialysis can take over the task of filtering and purifying your blood if your kidneys have entirely failed. Dialysis comes in various forms, such as hemodialysis at home and peritoneal dialysis. It is a process that rids the blood of waste and extra fluid. During dialysis, blood is diverted to a machine to be cleaned. Dialysis can only do 10 to 15% of what a healthy kidney can do. Another type of dialysis is peritoneal dialysis, in which a fluid called dialysate is introduced into the peritoneal cavity. Waste products and excess fluid are drawn into the fluid, and then the old fluid is drained and replaced with new fluid. Number 3. Kidney transplant. When kidney disease reaches critical stages, a kidney transplant may be required. It is surgery in which a healthy kidney from a donor is used to replace a damaged or diseased kidney. The following information conveys to kidney transplants. Donors. Both living and deceased donors may provide kidneys. A family member or another suitable individual may be a live donor. The procedure is carried out under general anesthesia and takes 2 to 4 hours. The recipient's bladder and blood arteries are attached to the donor kidney, which is positioned in the lower abdomen. Most kidneys begin to function within 24-48 hours, but it can take several days or weeks for some. A kidney transplant that is transplanted from a living donor typically lasts 20-25 years, while a transplant from a deceased donor typically lasts 15-20 years. Patients will need to take daily immunosuppressant medication to prevent their body from rejecting the donor's kidney. The information provided on this channel is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with your healthcare provider before making any decisions related to your health. Thanks for watching, and don't forget to share experience in the comments below. What changes are you making to protect your kidney health? Let's support each other on this journey to better health. And if you want more tips and advice on how to improve your kidney health, be sure to check out my other videos on health and wellness.